Greetings to all. Welcome back to this channel. Today we are going to discuss the advantages and disadvantages of cytology. And we are going to relate the advantages and disadvantages of cytology to histology. In other words, what could be the advantages of cytology over histology and disadvantages of histology to cytology. So, one of the advantages, let's start with the advantages of cytology. So, one of the advantages of cytology is that cytological specimens are easy, they are easy to collect as compared to histological specimens, because histological specimens in most cases require surgery, unlike cytological specimens like picking cervical smears or picking an aspirate. Number two is that results in cytology are obtained in a short time, as compared to cytology, whereby the specimen undergoes various processes, for example, from fixation to grossing, decalcification if it is required, tissue processing, until it reaches examination. Number three, cytology specimens, in terms of collection, there is less pain experienced during collection as compared with histology, where there is surgery and of course usually there is pain. Then in cytology, it is easy to resample the patient. For example, resampling a patient, probably the sample was not adequate or there was deterioration during storage. Unlike in histology, for example, if a uterus has been removed and it undergoes autolysis and putrefaction, you cannot resample a patient again to remove another uterus. But in cytology rather, you can resample a patient, probably blood collection. You can tell a patient to go back and bring urine if you feel the sample collected was not enough, or it had undergone deterioration because of poor storage. Then when you look at the disadvantages of cytology over histology. One of the key disadvantages of histology is that it's not a gold standard in terms of histopathological studies. In other words, in most cases, most of the cytological results or findings must be confirmed using histopathological studies. Number two, it's hard to relate the cell to tissue architecture in cytology, unlike in histology. So when you talk about tissue architecture, we're looking at the arrangement of cells in tissue starting from the basement membrane. And that arrangement of cells right up from the basement membrane is very important in diagnosis. That cannot be achieved in cytology because we look at individual cells. Number three, in cytology, the nature, size, and location of the lesion is hard to pinpoint in cytology, unlike in histology. And of course, nature, size, and location of the lesion is very important in diagnosis. So, as we summarize, let's look at the differences between cytology and histology. So what are the key differences between cytology and histology? One, cytology deals with the structural changes within the nucleus and the cytoplasm. And the structural changes within the nucleus and the cytoplasm, we look at them in individual cells. That is in cytology. But in histology, we look at the form and structure of tissues. The other difference between cytology and histology is that cytology, the whole process is inexpensive and simple means of diagnosis, which allow actually frequent resampling. But in histology, it is more invasive, and of course traumatic procedure. Then the other difference between cytology and histology is that with cytology, smears, we can use smears to evaluate the nature of inflammatory process. For example, we can identify fungi and parasites in smears under cytology. But under histology, it's difficult. It is very difficult to identify specific causative inflammatory pathogen. The other difference is that in cytology, the basic stain is the pap stain, or what we call Papa-Nikolai stain. In other words, we use a Papa-Nikolai staining protocol to stain smears. Though sometimes H&E can be applied, but in histology, the basic stain is H&E stain. The H&E stains, that is hematoxylin and eosin stains. Then the other difference is that in cytology, we basically use slides to carry out diagnosis, and those slides have smears. But in histology, we use sections which are obtained from paraffin blocks. Then the other difference is that in cytology, cytology provides rapid diagnosis. Of course, the collection is very simple, and also the processing of the sample is not as tedious as that one of histology. So we can obtain rapid diagnosis, unlike histology, where diagnosis is obtained after days. Lastly, cytology. In cytology, evaluation requires cells only, But in histology, evaluation usually begins with tissue biopsy. So those are the few differences between cytology and histology. Thank you very much for listening.